Okay, today we are going to see about compliance and regulatory. So, in the medical coding, compliance and regulatory is very important topic because whenever we are working in the RCM sector, we are handling that patient informations and that what are the rules they are following. Those and all we have to get to know. So this part they are explaining about the insurance, who are the provider, who is the patient, that information, everything, and what are the acts we are handling. That and all it will show in this compliance and regulatory. So in this compliance and regulative, what are the elements we are going to see? That one they have given here. Introduction to medical billing. So introduction to medical billing, we are going to see about the medical billing cycle, providers type, insurances. Then billing terminologies, GOBRA Act, Stark Act, code sets, then HIPAA. So first we are going to see about this what is medical billing. Medical billing is the process of submitting and following upon a claim with the health insurance companies in order to receive payments for service and rendered by the healthcare provider. So nothing but of once that the procedure is done, it will go to the billing. So before billing, that coding will carried out. After that, the billing team will check and they will process the claim and the payment will go to the provider. That is the process handled by the insurance companies. Okay, so that is a medical billing. So one by one we can see in the coming slides. So first that what are the terms we are using and their explanation given here. So first one, patient. Patient means a person who receives healthcare services. Mostly in these uh, topic, I will explain this the accurate what are the terms they have given. Because in the exam, it will you will get like this only. So that the terms you have to get to know properly. The terms and explanation. Okay. So first one, patient means a person who receives the healthcare services. Then provider, a person or entity which provides the medical services. Okay. So provider means who is giving the service. Then payer. Payer means that the insurance company. So insurance or anyone who pays for the medical service. Then insured. Insured means a person who is covered by the insurance. Then insurer, the insurance company. Then a subscriber or policy holder, owner of the policy. Then a dependent, family member covered under the subscriber's policy. So you can see the difference. Patient also receiving the healthcare service. But here, what is the difference between the patient and subscriber means in the family, one person is involving in that medical insurance policy, they will cover their family members also. They can cover the family members also. In that time, one of the family member is getting that sick and they are getting the service means in that time they are not a subscriber. But who is taking the owner of the policy? That person only subscriber. But in their subscribing, the family members also getting beneficiary. Okay, so that is a difference between patient and subscriber. Then dependent. Dependent means that one that the subscriber who is getting the policy, their family members they are involving in that policy means those peoples, that family members, those are called as a dependent. Family member covered under the subscriber policy. Okay. Then participating provider, a provider who has contract with the insurance. So participating provider means a provider who has contract with the insurance. Already the provider has a contract with a particular insurance company. Okay. Non-participating provider means the provider who doesn't have a contract with the insurance. Well, for an example, we can see in many places the the insurers, they are giving the list of the hospitals. These hospitals only we are paying like that. So like that policy, they have a contract between them. Okay. So if they doesn't have that contract, they won't give that uh, s- payment to the particular hospital. Okay. Then client. Client means customer. Subclient means our client's client. So for an example, um, uh, or particular one particular company is contracting with the one particular insurance company, that is a direct client. So that company's working employees are subclients, like that. So next one, introduction to the US healthcare. So the payers provide the coverage to the patients for a particular period, particular amount, particular type of medical conditions and treatment. So the payers who provide the coverage means that insurance company provides the coverage to the patient for a particular period, which means 1 year policy, 2 year policy, like that. In particular amount means up to 10 lakhs, up to 2 lakhs, up to 1 lakh, like that. They will fix that amount. In particular type of medical conditions means for these conditions only we will provide the service, means that a payment we will provide, like that. They have a contract. And particular treatments like that conditions, these type of treatments like high technology treatments, we won't provide. Only that ordinary treatment we will provide, like that. They have some um, particular contract value they will maintain. Okay. Then next one, insurance will process the claim and make payment to the provider based on the patient's coverage. So based on these contract only, they will provide the payment. Okay. So if they are eligible for up to 2 lakhs only, means if the treatment charges crossing 2 lakhs, the patient should pay the remaining amount. Only 2 lakhs, up to 2 lakhs only it is coverable, means 2 lakh only the insurance company will provide. Okay, like that. Then patients pays the premium to the payer to get the policy coverage for the payer. So for this insurance policy, the patients will pay the premiums. So monthly wise, or 6 months once, or 3 months once, or yearly once, they will pay, give the payment to the insurance company. So like that only that policy will happen. Then the patients who have insurance coverage provides will submit the claim to the patient's insurance, which means if the patient has taking the service, means they have to submit the uh, report details and everything. They have to give it to the insurance company. Then only they will give the payment to that service. Then, so this is the process happening here. So first the patient is taking the service to the provider. Then they will submit the claim and payer give the payment to the provider. Like that circle is going on. So first that patient will give the premium to the payer. So once get the service, then payer will give the payment to the provider. So that is a cycle going on between them. Okay. Next, revenue cycle management. So one by one process they will explain here. Revenue cycle management is a term that includes entire life of a patient's accounts from the creation to the payment. So how it is going on, that is called as a revenue cycle management. So revenue cycle includes various process like coding, billing, like that. So that flow into the um, affect one to another. So the process includes keep track of claim in the system, making sure payments are collected and addressing denied claims, which can cause up to 90% of the missed revenue opportunity. So every clients will checked, and if in case anything missing means it will be get denied. That denied claims they will check, and they will process the what is the missing, what is why it is getting denied, like that they will check. Then RCM encompasses everything from determining patient insurance eligibility and property coding claims. So in this RCM management, they have some criteria to check about the claims. So claim eligibility, that insurance eligibility, those and all they will check to process. So because of that, they will avoid the denied. And next, components of medical billing. So the US medical billing industry comprises of the following major components, like providers and patients, and insurance companies, billing office, transcription agencies, coding companies, clearing houses, federal government bodies. So one by one we can see in upcoming slides. So process involved in billing cycle. So first, patient. Patient means a person receiving or registered to receive medical treatment. Then demo info means demographic information about the patient. So demo information is the data about the patient, such as a patient name, address, phone number, date of birth, sex, religion, and employer. These are all details will given in the demographic information. Okay. Then file transfer protocol. So we are transferring the patient information with the demographic details, right? So whenever we are transferring one person to another person, or one company to another company, so what are the protocol they are maintaining? They are telling here it is a standard network protocol used to transfer the files from the one host to another over a transmission control protocol based network such as a internet. So control protocol means everything protected, password protected. Okay. Then provider who helps in identifying, preventing, or treating illness or disability. Then assignment of benefits. So they used to tell AOB, an arrangement by which the patient requires that their health benefit payments be made directly to the designated person or facility, such as physician or hospital. AOB means already the patient is have a contract with the particular hospital or particular physician. That is a AOB, advanced arrangement, like that. So assignment of benefits. Then a demo info, releases of information. So an arrangement by which patient authorizes the release of his or medical information to insurance or billing companies. So demo info, how they are releasing the information. So patient should allow the details. So these are the details need to give it to the insurance company. These are the details doesn't uh, need to send, like that. They will give the informations. Okay. Then transcription. Transcription means it is a medical transcription, or MT, is an allied health profession which deals the process of transcription or converting the voice recorded report as dictated by the physician or healthcare profession into the text format, which means mostly in the hospitals whenever they are doing the procedure, or providing the service, they will maintain the voice record, or that informations need to transcribed into the report, right? So that process will taken care by the medical transcriptionist. Okay. They will change that voice or recorded reports, or that whatever procedure done, that process they will converting into the text format. And next process involved in the billing cycle. First, coding. So before the billing, the coding. Once the service is received by the patient, the report will be transcribed. Then it will sent to the coding team. So, assigning numerical form of the diagnosis and service rendered by the provider or physician, converting a physician encounter to those codes allow the physician or a hospital to bill the payer, for the service rendered upon the him. So means once a service received, that transcribed report received by the coder, means the coder reviews the report and they will give the some numerical codes. So the particular codes will give the information about the what are the service provider. Okay, from the text form to they are converting into the numerical form. So for the procedure and diagnosis, both they are converting into numerical forms. Okay, so then this is a charge entry. Charge entry is a entering any information received from the physician office onto the medical billing software base. So, any information received from the physician office to the medical billing software base, they are entering the details, which means this place they have to update the patient or report. This place they have to enter the additional that information about the patient, this comparison details. Those and all they will given in the charge entry. Then clearing house. It is a private or public company that provides the connectivity, often serve as a middleman between the physician and billing entities or payers and other healthcare partners for the transmission and translation of the claims informations into the specific format required by the payers. So this is a public company or private company. Okay. So between the payers and the insurance company, is there any uh, lacking of the information or any transmission needed, that specific information so they want to check, means that clearing house will take care and they will collect the data and they will provide to the insurance companies. So those people are called as giving the service for the this getting the client paid. Then next one, adjudications. Adjudication means the claim adjudication is a term used in the insurance industry to refer the process of paying claims submitted or denying them after comparing claims to the benefit or coverage requirements. If in case there any missed information in the report, that one we want to know that the adjudication process will call the particular patient or provider. They will call the those people and they will collect the details. So that process is called as adjudication. Okay. Then cash posting. Cash posting of the payment details contained in the explanation of the benefit. Then accounts receivable. Accounts receivable are money owed on patient accounts to be payable by the insurance company or other patients. Then provider types. So provider type they have given. So first one is PCP. PCP means primary care provider or physician. Okay. So PCP serves as a gatekeeper in the managed healthcare system and usually specializes in the family medicine, internal medicine, pediatric medicine, or obstetric and gynecology. Okay. So who is giving the primary service? Those people is called as a PCP. Then physician extended. Physician extended pertains to the providers such as nurse practitioner, which means NP, advanced practice registered nurses, APRN, then physician assistant, PA, and clinical nurse specialist, CNS. They work along with the physician to deliver the healthcare services with medical direction and appropriate supervision as required by the law of the state in which services are furnished. Which means some places, some services like that. PA is not applicable in this hospital or in for this country. Like that is there in any country rule is there. That state rule is there. Means that one we have to follow. So who are the physician extender? They are supporting the service for the provider. Means that one they are called as a physician extender. So this one, why I am telling again and again these terms and the short terms means you may get option in your question. Okay. NP means nurse practitioner. NP. Then APRN means Advanced Practice Registered Nurse. Then Physician, Assistant, and Clinical Nurse Specialist. Then next one, non-participating provider or non-par. Non-participating provider describes a provider who elects not to the participate with a given healthcare plan. Non-par providers have declined entering into the contract with your insurance company. One reason may be the fee offered by the your carrier is less than what they are willing or able to accept. Which means I already said right. So particular insurance company is not having contract with a particular hospital or provider means that is that a physician is called as a non-participating provider, which means the provider they are billing for that particular service is a higher amount, but that insurance company is not okay with that means they are not creating the contract between them. So those type of providers only they are calling as a non-par. Then participating provider means they have a contract. So participating provider or par provider is contracted with the third party payer to participate with their policy procedures and fees for the healthy plan. Par providers are healthcare providers who have entered into the agreement with your insurance carrier. Your insurance carrier agrees to direct clients to the provider and the exchange the provider accept the lower fee for their services, which means that example they have given a lower fee means see um, um, so again we will use the example of your uh, skiing accident. So for one patient has got an accident, so they are coming to the orthopedic surgeon's clinic. Then he has submitted a claim for what he feels a reasonable rate. Dollar value is 7,500 for the surgery. So because the physician is contract has the contract with the particular insurance company, he can pay only that patient can only $5,000, which means in between them they have a contract. So you might wonder what happens to the remaining $2,500. So will the surgeon expect you to the pick off the remainder of the claim, or the surgeon may want you to pick up the remaining $2,500? Like that we will wonder. But because the contract in place, he is not able to back bill you for the remaining amount. Then what happens if you decide to use non-participating provider? Which means continuing with the example of your skiing accident, we will look at the claim for the company that provided you to with your where wheelchair and commode, durable medical equipment, also known as a DME. In this case, the company did not have the contract with your insurance carrier. They submit a claim totaling $2,500. Your insurance provider researches the charges and determines the usual and customary amount to the charge for the equipment provided is $1,500. So this is different because you use the non-contracting and non-participating provider. Your insurance carrier will only be responsible for the 50% of the usual and customary amount, $1,500 instead of the 75%. It would have paid if you used the participating provider. They would amount paid your insurance carrier that dollar value 750, half of the usual and customary rate of the 1,500. After receiving your insurance company's co-payment, the DME provider submits their bill to the you for the remaining 1,750, which means that is a co-payment of the that is $750 plus that 1,000 above the usual and the customary rate. Because they are not contracted with your provider, You are not protected from the agency going back bill you for the amount of over what is considered under customary. So that is a difference. If the payment, the provider has a contract with that insurance company, means that reductions will be there. If there is no contract, the reduction won't be there. That is a difference. The next one, traditional healthcare insurance. So healthcare insurance is traditional healthcare insurance and managed healthcare insurance, like that. There's a different types of healthcare insurance will be there. So first we are going to see about the traditional healthcare insurance. So traditional healthcare insurance means these plans allow you to choose any doctor, which means some specialist also may require pre-approval. But the patients pay more out of the packet expenses. So you can see, which means packet expenses means co-pays and deductible. Traditional health plan, it is allowing to choose any doctor. Okay. So if in case any specialist is there, means we want to check the pre-approval, but they can select the physicians who is giving the treatment. Who the patient want this doctor only, means so that and all they can select. But the patient, they have to pay some more than the usual one. Then managed care plan means the general term that refers to the healthcare plans that attempt to control the cost and quality of the care by the coordinating medical and other healthcare related services. So it will reduce the cost, which means the patient no need to pay again. Then responsible for the healthcare services to an enrolled group or person. So the particular healthcare services, we can take the services and directly. Then coordinate various healthcare services. So it will connect the various healthcare services. Then negotiate with the providers and groups. We can negotiate. Then comparison between the traditional healthcare and the managed care they have given here. So no network benefit. So no network benefit means this contract is there, particular service, we can get reductions. Those and all won't be there in that traditional care. But in the managed care, those and all will be there. So the usage of the cost is will be less. No PCP referral required, which means can can you please mute yours? In this, no PCP referral required. Um, in managed care, PCP referral required, which means primary care physician referral required. Okay. Then this traditional care means optional preventive care program, which means this yearly ones that is mammogram test they have to do. Then bone scan, bone density testing, like this. One preventive care program under optional only. But in the managed care, it is mandatory to get the preventive care program. Okay. Then what are the types of managed care is there? So you can see first one is HMO, Health Maintenance Organizations. So HMO is a health maintenance organization. It is refers to the healthcare plan where all care is guided by the primary care physician. So in this HMO, that all care will guided by the primary care physician. Then assigned physician that act as a gatekeeper to refers the patient outside organizations. So they will take care everything about the patients. If they are referring that other organization also, they will check. Then out of packet expenses are minimal. So patients no need to give more cost to that services. They can use the minimal amount only. That co-pay and all, it will be very less. Then preferred provider organization, PPO, preferred provider organization, which means it is one that contract with the physician to provide the service at reduced rate in exchange for the patient volume associated with the organization, which means the individual provider, they have a contract. So in between that contractor, so they will do the service and they will offer with a lesser payment. Okay. Then patients must use the provider in the PPO network or be subject to higher out of the pocket expenses. So if in case the patient is going apart from this particular physician, means that copay and all, it will be more. Then point of service, POS. In network, out of network providers may be used. Then benefit are paid at the higher rate into the network provider. Then subscriber are not limited to providers but to amount covered by the plan, which means they can take the plan to any providers. Out of the providers also they can use, but it will be little more than the whatever in the network providers. Then wherever they are going, it should be covered in the plan. Like that, they are maintaining the policies. Then exclusive provider organization, which means EPO, exclusive provider organization. A managed care plan where services are covered only if you go to the doctors or specialists or health hospitals in the plans network, except in emergency. Which means in this type of policy, they have to go to that particular doctor or specialist or hospital only. So the if in case emergency means it is we can go to that other hospitals, but they will transfer to the particular hospital after fixing that stabilizing the patient. Then it involves the network of medical care providers which provide the healthcare to the subscribers, health insurer, wherein the subscriber are required to the choose primary care physician from within the network. That only they are again telling. Then EPOs are beneficial because their cost effectiveness, since the insurer can negotiate low premiums and co-payments with their providers based on the guarantee that policyholder will visit the network doctors only. So same only. So particular network of doctors only they can go and take the service. Then only the service amount will be lesser than the usual amount. So you can check the features. What are the features between these four type of managed care policies? So first one, HMO. It is a individual plan, and the PO is also an individual plan, and the PPO is a group plan, and EPO is a group plan. Then PCP referrals, coming to PCP referral. For the HMO, need PCP and referral, and POS also need PCP and referral, but PPO and EPO no need PCP and referral required. Then next to that, network benefit. Network benefit means no out of network benefit for the HMO, and have out of network benefit, but we have to pay little amount. Then PPO have network benefit, out of network benefit. Then EPO no out of network benefit. So in this POS, they can they can have the out of network benefit, but the cost will be more. But the BPO means they can take the network benefit, but apart from that plan, some plan will be there. So if in case in that plan it is covering, means the cost will be lesser. But apart from the plan they are going, means in that time only they have to pay more. Then insurance. First one, federal insurance, which means government insurance. So example for federal insurance are Medicare, Medicaid, then CHAMPA and CHAMPUS. So we can see this Medicare, CHAMPVA, and CHAMPUS. These are the insurance is covered under the government insurance. Then non-federal insurance means that private insurance. So you can see PCBS, Aetna, WC, like that. So many insurance, private insurance will be there. Here example only. Then what is Medicare? So in the government insurance, Medicare, Medicaid, for Champers, they have given, right? So first we'll see about the what is Medicare. Medicare means a federal insurance program which primarily serves those over 65 years or disabled people and people with the end stage renal disease. So you have to get to know what is a Medicare insurance means. It is a government insurance and it is primarily serves for the whoever crossed those 65 years are disabled people and people with the ES end stage renal disease. Okay. And permanent kidney failure treated with the dialysis or transplant. Then CMS administers the Medicare program and works in the partnership with the state to the administer the Medicaid and state children's health insurance program. Okay. Then the agency also oversees health related federal level legislation such as aspect of the Health Insurance Portability and Accountability Act, which means HIPAA. It is created in the 1996. So these whatever policy, it will act by the law of this HIPAA. Then types of Medicare coverage. So Medicare, different types will be there. So Medicare Part A means pays inpatient hospitalization, many outpatient services and procedures, skilled nursing facility care, and home health care. So it pays for the inpatient hospitalization, many outpatient services and procedures, and skilled nursing facility care and home health care. Okay. Then a local Medicare fiscal intermediary administers the funds for this program. So for this government, they will give that local Medicare fiscal intermediary administrators, so they are funding. Okay. Then Medicare Part B pays for the outpatient and provider services. So pays for the outpatient and provider services. Then a local or regional Part B Medicare carrier with the administered payment to the Medicare Part B claims. So in the local regional Part B Medicare carriers will administer the payment. Then Medicare Part C. It is also known as the Medicare Advantage, which means beneficiaries entitled to Medicare Part A and Part B are eligible to switch to the Medicare Advantage plan provided the beneficiary resides in the plan service area. Okay. Then Medicare Part D is the prescription drug benefit. So the decision to sign up the Medicare prescription drug coverage benefit and how the beneficiary pays the prescription drugs and the type of the Medicare coverage. So usually for the drug, they won't give the payment. So here that drug payment also will get benefited. So next one, Medicare physician fee schedule. So how the fee schedule? Medicare physician fee schedule is list all of these fees associated with the service rendered by the provider. Then the fee schedule is based on the resource required to provide the service. So what are the procedures they are doing? They have a fixed amount for this service and they are uh, given in the category what is covering in that Medicare. Okay. Then there are 3 units of the physician services. Each one is called a relative value unit. Wherever different type of physician is there also, they have to give the uh, fee structure is related to the relative value unit amount. Then the three units are physician work expense, practice expense, and the professional liability insurance. So these there is a three units, right? That those three units uh, related to the physician work expense and practice expense and the professional liability of the insurance. Then these three values are added to the together and adjusted using the geographic practice cost indices GPCI assigned by the CMS for the geographic location where the services are rendered. Then final outcome is multiplied by the national conversion fact to arrive at the amount that CMS will pay the each service under the fee schedule. So how they are giving? So for the Medicare patient physician schedule already divided and it is listed in for the particular service means these are the amount they have to check. Okay, so that one how they are working based on the three unit. So each physician work based on the these unit only. That these three unit is called as a relative value unit. So you can see what are the three units means physician work expense, which means how that for the physician payment, and the practice expenses means for the service expense, and professional liability to the insurance. So based on these three unit only, they are giving the chart and they are giving the list of the amount for the service. Then officiating office. So officiating office means how they are planning those and all they have given here. So first one US Congress, then Department of Health and Human Services, then Social Security Administration and the Center for Medicare and Medicaid Services and Railroad Retirement Board. These all are involving in this plan and all. Okay. Then DHS. DHS means this one Department of Health and Human Services. So delegated to CMS. Then CMS runs the Medicare and Medicaid. Then CMS delegates daily operation to the Medicare administrative contracts or fiscal intermediaries. Then that Medicare administrative contracts and fiscal mediaries are usually insurance company. Okay. Then funding for the Medicare. So how the fund will come to the Medicare? So first one, social security taxes from the people. Then equal match from the government. Then CMS sends the money to the these two. Then these two handle the paperwork and the pay claims. Then Medicare coverage. Medical coverage, medical necessity and frequency limitation are defined in local coverage determination and national coverage determination, which means LCD, NCD. Okay. So medical necessity and frequency means, for an example, LCD, NCD, for if in case for the patient they are doing one service. At the same day, they are a related service they have performed means, which is necessary or not necessary, they have to give the documentation because which is both are same only why they are doing the related service like that they have to give the explanation for that if needed it is a different we are different procedure only for the different purpose we are doing means we have to denote that with using the modifier. For an example, in the coding we are using the 59 modifier, right? Based on this LCD and NCD coverage only we are giving the modifiers. Sorry, that is for modifiers. That is for CCA edit. And this LCD NCD means for this service they are providing for this abnormality means that one they have to check. So the service and abnormality is not related means they have to get denied. So based on this national coverage determination and NCD coverage determination only, they are giving the particular service we are providing means particular abnormality should be there. Like that they will give. Okay. Then next beneficiary pays. Beneficiary pays means part B and part A will be there. So part B means 25% of the Medicare approved amount after deductible is met. Then part A means deductible for the service rendered. Okay. Then Medicare pays means part B, 80% of the Medicare allowed amount for the covered services. Then part A means all covered cost except deductibles. So particular amount we are paying from the patient side means based on the part A and part B, they are checking. So part A beneficiary pays means 20% of the Medicare approved amount after the deductible method. Then Medicare pays means 80% of the Medicare allowed amount of the covered services. Like that, difference will be there. Then forms. CMS 1500 form is a standardized medical claim form used to submitting the Medicare Part B charges to third-party payers for the physician and other providers services, procedures, and allied supplies. Then UB04 or CMS 1450 is the paper claim form for the inpatient billing. Then type of the claims they have given here. So first one is paper claim, second one is electronic claim. So in the paper claim, the standard format prescribed by the CMS, namely physician claim, which means CMS 1500. Then hospital claim, UB04. Then electronic claim means NSF, which means National Standard Format, limited by carrying the capacity. Then ANSI, American National Standard Institute for the flexible format. Okay, so we completed that Medicare. Now we are going to see about the Medicaid. Medicaid means it is a national health care program. It helps pay for medical services for the low income people. So Medicare for the people we have given right that age above 65 and disabled people and ESRD patients. For this Medicaid for the low income people. So Medicaid eligibility below poverty line, low income group. Then blind aged people who are 65 and are older. Then disabled people who are unable to work due to serious physical or mental condition that has lasted or expected to last 12 months or longer. Then widower age 50 to 65 includes recipients of the social security widower insurance benefits who do not receive the Medicare. So widower age 50 to 65 includes recipient of the Social Security widower insurance benefit who do not receive the Medicare. Then 8 to families with the dependent children medically needy, which means that some children are doesn't have their family, but those children uh, allowed to grow in a different family. So based on this category like AFDC, um, medically needed, those children also covered under this Medicaid policy. Then 8 to families with the dependent children medically needy, they have given here AFDC was the federal assistance program created by the Social Security Act and administered by the US um, DHS that provide a financial assistance to children of the single parent or whose families had low or no income. So AFDC provides assistance to support children who had lost one or both parents to death and disability, etc. Then AFDC was replaced by the TANF. Then TANF means temporary assistance for the needy families. Okay. Those family related children's only, they are coming under the coverage of this AFDCMF. Then next to that is CHAMPUS. CHAMPUS means Civilian Health and Medical Program of the Uniformed Services. Okay, Civilian Health and Medical Program of the Uniformed Services. Then insurance linked to military services, also known as the TRICARE. Then CHAMPUS is a healthcare benefit program for active duty and retired members of the military. Then CHAMPWA, the Civilian Health and Medical Program of the Department of Veterans Affairs, is a healthcare benefit program for the permanently disabled veterans and their dependents, which means they who serve the government service, but they got a disability because of this service, means that is CHAMPWA. Eligibility, you are the spouse or child of the veteran who has 100% rating of the service connected disability. Then you are the spouse or child of the veteran who died from the service connected disability that had been veteran affairs rated. Okay. Then comparison. What is the difference between the CHAMPUS and CHAMPWA? So medical insurance program through the Department of Defense. So they are being in that service. Then medical insurance program through the Veteran Affairs. Then must be active or retired military, but cannot be retired be military. So cannot be retired military. Then must be enrolled in DEES, which means the Defense Enrollment Eligibility Report System. No DEES enrollment for the CHAMPWA. Then no disability criteria to be eligible. So if disability is there, means they won't be in the active defense department. So veteran must be 100% service disabled or died on a active duty or died such as a result of the SC disability. Then spouse and dependent children are eligible to participate in this program. Spouse and dependent children are eligible to participate in the program. Both are same only. Then defense enrollment eligibility reporting system. So automated system of the verification of the person's eligibility to receive the uniformed service benefits and privilege. So in this reporting system, what are that they are telling? That one related to the service only. So next, that DES records and tracks the eligibility of the military benefit, including TRICARE and the active duty and retired service members and their eligible dependents. Those and all they will track. Then service members are automatically enrolled in the system. So once they are coming to the military services, automatically they will enter the details, right? So then dependents must be manually enrolled and all changes in eligibility tracked. So dependents also manually they have to track. Then next one, Medigap insurance. What is Medigap insurance? Privately purchased individual or group healthcare insurance policies designed to supplement Medicare coverage. So how we are in India, they are giving um, this Medicare services and all, we are taking an own by private insurance company, right? Like that, they are purchasing, means that is a Medigap insurance. Then benefits may include payment of the Medicare deductibles, co-insurance and balance bills, as well as payment for the service not covered by the Medicare. So if they are, these people are not coming under this Medicare services. Then workers' compensation, insurance coverage provided by the employers to cover the employees insured on the job. Then birthday rule. So used to determine the coordination of the benefits, which means primary or secondary for the children. Insurance only use the month and day to the determine coverage. Then the listed below are few examples. Parents parents are married, the insurance of the parent whose birthday occurs first in the calendar calendar year is primary, while the other parents' coverage would be secondary. Then, if the parents have the same birthday, the parent who has had their insurance plan, the longest would be considered as a primary. So, here also, this beneficiary for the birthday rule. So, if they are covering primary and the secondary. Based on that, they are considering the patients coming under the primary and secondary. So if the patient has the first in the year who is has first in calendar, that should be the primary parent, and the second one is the secondary. And if in case both are in the same day, so who is the uh, uh, longest one in the insurance plan, that person is a considered as a primary. And Cobra Act, Consolidated Omnibus Budget Reconciliation Act, is a federal law that allows a worker to continue the purchase employer paid health insurance for up to 18 months if she or he lost the job or the coverage is otherwise terminated. Then the important rule that the employee must continue to pay the premium that the employer period. Then skilled nursing facility, SNF. A facility either freestanding or part of hospital that accepts the patient seeking rehabilitation and Medicare that it less intense than that received in hospital. So skilled nursing facility means some patients have uh, nurse care, but they are not keeping the patient in hospital. So they cannot give the they cannot take care of the patient in home. In that time, the skilled nursing facility give the service. So we have to pay for that skilled nursing facility. It is not a hospital. It is uh, like a hospital. Then Centers for Medicare and Medicaid Services, which means CMS. Uh, U.S. federal agency which administers the Medicare and Medicaid and the state children's health insurance program. CMS provide the health insurance for over 74 million Americans through these programs. Then UPN, which means Unique Physician Identification Number. So for every physician, that PIN number will be there. So that one, yeah, Medicare UPIN number is a national identification number which will remain the same no matter where the provider practices. Any healthcare provider who has the enrolled with the Medicare with only have one UPIN, which means one physician have one UPIN means if he is coming for this state, this particular place, and tomorrow they are giving to next hospital, they are giving the service also. For him, only one unique PIN, that PIN they can use wherever he goes. And this is issued by the Medicare for the each provider. Then PIN. A PIN, provider identification number, is a number that links with the provider to healthcare institution in which they practice. Then if a provider sees patients at multiple separate institutions, they will have the multiple PINs. So this PIN means for this hospital one number and another hospital different number, like that they will have. So this will be issued by the institution where they work. So like employee ID. So in this company, employee ID, one employee ID will be there. Another organization, different employee ID will be there. No, based on the organization how they are giving, like that. Based on the hospital, how the institution, they will give the PIN. That is a difference from the UPN. Then NPA. NPA means National Provider Identification, or unique 10-digit identification number issued to the healthcare providers in the United States by the CMS and NPES, which means the National Plan Provider Enumeration System. Means that national level, they are, wherever which state they are going, also they have a only one PIN, that is NPI number. Each provider has that NPI number. That U-pins were discontinued in the second quarter of 2007 and are replaced by the national provider number, which means NPI number. Previously, they are using that UPI number, but nowadays, if you are checking that NPI numbers means we can check US doctors numbers also, UPI, NPI numbers also now in Google itself. So for each and every provider, that NPI number will be there. That won't be get changed. Then Block 17B and CMS 1500. This is these policies are taken care. Okay. Then Social Security number. So the United States Social Security number is a 9-digit number issued to the citizens. So the first 3-digit field is called the area number, and the central uh, 2-digit field is called the group number, and the final 4-digit field is called the serial number. Then next, code set. Code set are the codes used to identify the specific diagnosis and clinical procedure on claims and encounters the forms. So for a particular code sets means in the coding how they are following. So each and every procedure individual codes will be there. Each and every diagnosis we have a uh, codes, separate codes will be there. That is uh, that classification derived by that AMA, CMS involvement. So that is a code set. Then the current procedural terminology means for the procedures they have created that CPT is published by the American Medical Association and the collection of description that depicts the various medical services available. So what are the medical services procedures we are doing? We have a individual CPTs. Then a comprehensive review of the CPT that includes history, structure, coding convention, and the coding concepts included in this program. Then current dental terminology means CDT refers to the codes used by the dental office to submit and process the dental claims. Next one, ICD, which means ICD 10, we are 10th revision only we are following them. Previously that ICD 9, 8 like that it is there. So now we can see about the ICD 10 CM. International Classification of Disease, that means ICD. 10th revision clinical modification is an international coding classification for the disease, anomalies, syndromes, external cause of injury, chemical imbalance, genetic illness, and administrative reasons for the encounter with healthcare. These are that is ICD 10CN. The National Center for Health Statistics, which means NCHS, and the clinical modification CM to ICD 10CM for use the United States. Then Healthcare Common Procedure Coding System means HIPICS. Healthcare Common Procedure Coding System. HIPICS, also known as the Level 2 codes, was created to describe the supplies, some procedures and services that may not be found in CPT, which means Level 1 CPT codes. And uh, provider greater specialty of the description. Then diagnostic and statistical diagnostic and statistical manual of mental disorders and 4th edition. So published by the American Psychological Association. So the code set classifies the mental disorders and addictions in greater clinical details than what is provided in ICD 10CM. Okay. Then acronym DSM means Diagnostic and Statistical Manual of the Mental Disorder. Okay. DSM-4 refers to Diagnostic and Statistical Manual of Mental Disorder 4th edition. Okay. Then Advanced Billing Contract Codes. So, which means ABC codes. Advanced billing contract codes are alphanumeric representations of alternative medicine, nursing, and other integrative healthcare inventions. Okay, so the codes describe healthcare inventions is the detailed not available in CPT. Okay, so ABC means it it will give the more information than the CPT, which is not available in the CPT. The codes address alternative medicine therapies, including acupuncture, herbal medicine, massage therapy, body work, neuropathy, Ayurvedic medicine, then chiropractic, homeopathy, nursing, and midwifery. Then diagnosis related group, which means DRG. It is a patient classification system adapted on the it is a patient classification system adapted on the base of the diagnosis consisting of distinct group. So based on the diagnosis related, that service will be provided. That is a DRG. So it is a scheme that provides a means for the relating type of the patients a hospital treats with the cost incurred by the hospital. Then DRG based upon the patient's principal diagnosis, ICD diagnosis, gender, age, sex, treatment procedures, discharge status, and the presence of complications or comorbidities. So particular abnormality, particular gender type, particular sex type, particular age type, we are giving this treatment means this comes under the DRG procedure. Then it is a system developed for the Medicare as part of the prospective payment system that utilizes the predetermined rate per case or type of the discharge. Then DRG have been used in the US in inpatient hospital discharge and the emergency department encounter to determine how much Medicare pays the hospital, since patients within each category are similar clinically, and some group of the patients having common demographic, diagnostic, and therapeutic attributes is the same level of the hospital resources. Then fraud. Fraud is an international representation that an individual knows to be false or does not believe to be true despite understanding that the representation could result in some unauthorized benefit to himself or herself or some other person. We know what is fraud, that explanation they have given. So, the most frequent kind of fraud arises from the false statement or misrepresentation that allows the provider to collect the reimbursement from the Medicare that he or she is not justified to collect. The other violation coming under the classification of a fraud are offering a acceptance of kickbacks, then routine waiver of the co-payments, then fraudulent coding activities including unbundling, downcoding, and upcoding. So this is very important for the coders for the coding activities including unbundling, downcoding, and upcoding. Then next, abuse. Abuse is the terms associated with the providers whose medical, business, or fiscal medical practices falls outside parameters that may result in the service not being considered as a medical necessary. So unnecessarily they are giving the services. Those and all, that is abuse only. Then, unlike fraud, which involves in the intentional deception or misrepresentation, abuse occurs when a physician provides the supplies mistakenly, bill for item for the service that should not be paid. It generally involves impropriety and lack of medical necessity for the service provided. False Claim Act. So the False Claims Act imposes the civil liability on any person and entity submitting the false or fraudulent claim for the payment to the United States government. It allows the individual whistleblower who knows about the person or entity who is submitting false claim to bring the suit on the behalf of the government and to share the damages recovered as a result of the suit. The whistleblower bringing the case is called as a quick time relator. which means if anybody is claiming the um, uh, money for a false claim, means that one another person can inform. That person is used to call as a quit tag. It is also called as a Lincoln law. Then auditing medical records. An audit is an action of comparing physician records, claims, and medical records to verify expected treatment outcomes, medical necessity of the service, appropriate documentation to support fees, and reasonable charges for service rendered. So usually auditing means they are checking, right? So it is needed or not, it is a false claim or fraudulent activity. To avoid those, one they are doing the audit. So in that they will find out everything. And the OIG, Medicare, Medicaid, and other insurance carriers make contact audits. Then prospective audit, auditing patient records against the proposed medical information. Then retrospective audit means post-payment audit, auditing paid claims. Then regulatory practices, the Office of the Inspector General, which means IOG of the HSS, is mandated by the public law to engage in activities to test the efficiency and economy of government programs to include investigation of suspected healthcare fraud and abuse. So these people will take care. Okay. Then the OIG publishes the OIG voluntary compliance program to help physician and other entities adhere to healthcare regulation. Then the Operation Restore Trust. It is a ORT program launched in May 1995, was an effort to restore the integrity in the Medicare program. Then ORT was designed to demonstrate new partnership and approaches in finding and shipping fraud and waste in the Medicare and Medicaid programs. Its mission was to identify and penalize those who willfully defraud the Medicare and the Medicaid program. Then OIG work plan they have given here. It describes the various project areas that are perceived as critical to the mission of the DHS. Then the work plan assists the HS is pursuing criminal and convictions by recovering the maximum dollar amounts through the judicial and administrative method. OIG work plan particularly reviews Part B reimbursement methodology and reviews the adequacy of the Part B payments, both in general and under average sales price methodology used for the computing drug cost under the Part D Medicare program. Then Omnibus Budget Reconciliation Act in 1989. It replaced the reasonable charge payment mechanism with the fee schedule for the physician services. And this payment approach requires the established and national conversion of factors. It requires Secretary of the Health and Human Services recommend the CF by April 15th for the following calendar year. Then this federal law gives the additional COBRA continuation to those deemed disabled when they have first qualified. This extends group health coverage from 18 months to 29 months post their employment. Then Stark Law. Stark Law refers to legislation regarding financial kickbacks between hospitals and providers for the federal reference, which means vendors and providers. Then kickback is a financial inducement or reward for sending business to either provider and a hospital, or provider and the DME supplier, or provider to provider situation. For example, if physicians send all of these patients to one certain hospital supply store and get 10% cash back on the all sales that result from these referrals, the situation is considered as a kickback. Then preventive screening test, immunization and vaccines are exempted from Stark law till they meet the relevant frequency limits mandatory by CMS. So whenever they are taking these particular medications, that the relevant frequency means within the year this many times only we have to buy, like that, or some policies will be there. Okay. Then clinical laboratory improvement amendment, which means CLIA. CLIA regulations established in 1988 and adopted by the Medicare and Medicaid. Then CLIA regulation determines the type of laboratory studies that can be performed by each laboratory. Then all laboratory must be certified by the CLIA standards, which means, for an example, for this, before doing this test and all, we have to maintain this uh, st- uh, standardized policies, like we have to wash our hand, we have to maintain that sterile equipments, like that. Some policies is there, right? That is derived by CLIA only. Then once certified, the laboratory can bill Medicare and Medicaid with the certification number assigned. So the laboratory want to get the payment from the Medicare and Medicaid, means they have to maintain these certifications from the CLIA. In CLIA waiver designation limits the lab services they can perform. Then this CLIA only deriving this particular test, means these are the protocols we have to follow, like that. They are having that designs. Then Health Insurance Portability and Accountability Act. So this is a very important act, and we have to get to know each and every person who is coming under the coding or healthcare sector, like medicine, everything. So they have to get to know about the HIPAA. HIPAA is passed in HIPAA was passed in 1996 to amend the Internal Revenue Code of the 1986. So to improve the portability and continuity if health insurance coverage in the group and individual markets. So this HIPAA is created to combat waste, fraud, and abuse in health insurance and healthcare delivery. Then to promote the use of medical saving account, to improve access to long-term care services and coverage, to simplify the administration of the health insurance. These all these all criteria the HIPAA is created. Okay, this is a compliance and regulatory. Um, so in the Medicare sector, these and all everything, and coding and billing, the people should know these whatever we have discussed in this.